I was watching all the like previous videos, and like the first, I don't know, like 5 seconds, there's always like la 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 ha ha ha, and then we do the seamless like intro.
That
Do
was
we have to
it.
do one of those?
You just did it. We did it. Way to go, Therese. Therese Astillero is a patient education specialist at SeamlessMD, where she designs engaging evidence-based digital care plans for patients. She's an experienced registered nurse with a specialty in cardiovascular surgery and has been recognized with awards from the Ontario Nursing Informatics Group and the Wellesley Hospital School of Nursing Association for her dedication to improving the patient experience. Driven by her frontline work, she completed her Master of Health Informatics at the University of Toronto, where she is passionate about using technology in healthcare to support both clinicians and patients. Therese prides herself on being able to contribute to moving healthcare forward while maintaining patients at the forefront of care. On her time off, she enjoys traveling anywhere and everywhere around the globe in order to learn about different cultures and histories and become a better global citizen. Therese, welcome to the show.
Thanks for having me, guys. How are you guys?
I'm doing well. I can't speak for Josh, but I think Josh is doing all right.
Speak for me. Am I doing well?
Josh, you're doing well today.
Oh, thank God.
You can just ask Siri. Therese, we're so glad to have you on the show today. You know, what really makes SeamlessMD successful is the fact that we are an interprofessional, multidisciplinary team. We have, you know, clinicians working with the team. We have nurses. We have dietitians. We have patient education specialists. And so, Therese, today we really wanted to highlight yourself because you came from that clinical world. You were a registered nurse in cardiac surgery or cardiovascular surgery. And now you're making an impact in the digital health space. To maybe kick things off, Therese, I was curious, you know, transitioning from your nursing background, what is it that kind of got you most excited about working in digital patient engagement?
Yeah, that's a good question. I guess it all started really on the front lines. The unit that I work on, or like the clinical area that I've been working in, we were often a place where we would be chosen to pilot new technologies, new processes. And it's always funny, especially when there's a new technological implementation. Some of the older nurses would come to the younger nurses, which was me, and they would ask us, you know, how do I make this thing work? Why is it not doing what I wanted to do? And after a few instances of that, it got me thinking, maybe there's a role out there where I could actually, you know, maybe vet some of the tech that's coming into the clinical workspace to make sure that actually matches the realities and works for clinicians so that eventually it does trickle down to the patient. So I looked around and there was something, and it was my Master's of Health Informatics. So I signed up and I did the program, and they basically in that program, they taught me all about digital health, ways that you can leverage technologies from other sectors and apply it to healthcare. And that's kind of where I got started. And then I found Seamless, and then I got into patient engagement because I wanted to just use the clinical background I had to put it into the program and, you know, help out patients.
So Therese, you know, one of the things that I think really excited me when we met with you was whenever we work a lot of different clinical, you know, partners and different hospital customers, we always run into these like really awesome, you know, nurses who just totally get SeamlessMD, and they end up being like phenomenal internal champions for the innovation with their patients or with the other, you know, healthcare providers, the administration. And we always used to joke about like, wow, wouldn't it be great if these like great, you know, clinical champions internally, they weren't stuck in that one organization. They could move around to all these different hospitals and kind of, you know, teach those organizations how to be, you know, successful with Seamless for their patients. And so what's really awesome about you is that because you're actually part of the Seamless team, you kind of can be that clinical champion. And like obviously you're with the company, but as you kind of meet these different clinical partners that we work with and help them out, you're almost like that clinical champion that can be transported. And I think one of the really cool things about Seamless, as Ellen kind of highlighted earlier, is that, and tell me if I'm wrong, but I almost feel like when you're talking to these health system partners we work with, like when they learn that you're a clinician by training, it's almost like you have a stronger bond with them when you're implementing Seamless and like teaching them about it. Is that fair to say, or what's been sort of your experience?
Yeah, definitely. I think it's fair to say it does make an impact when you say that you do understand what their, day to day could look like. Maybe it's not exactly what I experienced, but I understand some of the hardships that go through or that they would go through. So it does, there's a little bit of credibility that comes with that, and maybe a little bit more respect for what I might have to say about Seamless, or how I understand what they might be trying to convey to me.
Yeah, one of the things that Al and I were talking about before the podcast was that in a weird way, Seamless is a little bit like almost like a hospital team ourselves, because we have like the IT people and like the operations and all that, but we have like the clinical team. And so I almost feel like internally, like our culture kind of represents a hospital culture in many ways, and that helps us kind of be more empathetic, I think, sometimes. Whereas I think a lot of other like tech companies are just so tech heavy in their team that bleeds into the culture, bleeds into how they think about their product. And we're kind of lucky that we have all these, it's almost like we can be the customer in many ways.
Yeah, I think it's really valuable that we have people who've been on the front lines as part of our team. I think it really does help to elicit some of the experiences that patients might have. And it's not always something that you would know or read about. It's just something that you've learned because you've been there.
Absolutely. And maybe on that topic, I think, Alan, you had some questions about the patient experience that you wanted to dive into.
Exactly. So Therese, I know, when at SeamlessMD we're designing a new program for a new specialty like cardiac surgery, we always go out and interview patients first to understand, what are topics that might be concerning for them if they've already gone through a surgery. What were things that they wished that they had known ahead of time, or different reminders that they need to stay on track with their protocols. Um, in your experience talking with cardiac patients before SeamlessMD and then during your time with SeamlessMD so far, what have been some of the unique topics or concerns that patients told you, this would be important to cover specific to cardiac surgery, or at least just for their surgical journey?
Yeah. So I think the most important thing to point out is patients having cardiac surgery, they are aware it's their heart. And even if they're like not from a medical background, they know that their heart affects every other system in their body. So it is a large surgery, and it is a scary, journey that they are going through. So from my experience, pre-op patients are, afraid about the actual surgery itself. How is it going to go? Will I make it out okay? Are there going to be any complications? But when they get closer to that surgery day, their focus or their mindset starts to change to, okay, maybe after the surgery, what's going to happen? So it's more about like the fear of the unknown. And after coming out of surgery, will I be able to go back to normal? Will I have a new normal? Is there even going to be a normal? And how will the surgery affect my quality of life? So, when we discharge eventually after somebody has had their surgery, when we discharge patients, we talk about, we would have hand them this like folder that has like a bunch of pages in it. And we would go through each of these pages, takes like, I don't know, 30, 45 minutes. And we tell them things that they should and shouldn't do and when they should call, things like that. But it's really that each patient, what is a concern to them is really about what they value in their life and what do they prioritize. So, for example, some cultures are very big into, food, and food is being with family and being together. But when you have cardiac surgery, you have to maybe make some changes in the way you eat and the things that you eat. So they'd be interested in knowing things like, how do I, reduce my salt intake but still make my food taste really good? Or can I still eat some of the culturally, like some of the foods that I eat from my culture, and is it okay, or do I have to make adjustments? For others, it's maybe more about the physical body, where they are, I don't know, a regular exerciser. They want to do their marathons, and for them after surgery, they want to know, what are the things I need to do so that my body can go back to exactly where it be, or really close, so that I could, run that 10K that I already signed up for. So we would talk to, or maybe give them some education around things like incentive spirometry, so that they can, open up their airways. Or we reinforce things with like physiotherapy. So how do you ramp up every day you're walking, how often should you be walking, the duration you should be walking, and when should you know that you should maybe pull back a little bit. Doing ankle pumps if you're in the hospital and in the bed, maybe I can't be walking right now because I'm not 100%, but I can still be doing something. And I think the most important thing for cardiac surgery patients is also sternal precautions. We forget how often we use our hands to do things. It's just, we grab something, we pull out the vacuum, we pull up a pot or whatever it is. And there are restrictions and things that you shouldn't be pushing, pulling, or lifting and to like a certain weight. And so for those patients, their concern is getting that kind of information. And then you also have patients who are just, they have all the support and they have everything they need. They don't really have any other concerns than, when do I call for help? I had this surgery. And I'm going home. I have people around me, but what do I need to tell maybe the people around me so that we know that I need to take an action? How do I tell the difference between pain from my incision or their surgical wound versus am I having another heart attack inside or something like that, or something else is wrong? So what is a concern to a patient, or what I've heard both from our calls when we talk to patients for Seamless and from experience, it really varies based on what's important to them.
So Therese, I was hoping we could maybe dive in a bit into some detail on some of the things that you just brought up and how that connects to, I guess, what we try to do with Seamless and digital patient engagement. So, I think back to, a couple years ago, one of the first patients I ever, I think, personally interviewed who had had surgery and been on Seamless. This was a patient who had lung cancer surgery. And I was asking him about, what difference Seamless made for his experience. And he told me how, when he had his first appointment with the thoracic surgeon and then kind of just learned that he had lung cancer, he tells me how, the moment you hear you have lung cancer, and I don't know if this is true for the moment you hear you need to have heart surgery. I'd love to get your take if that's true as well in cardiac. But the moment you hear you have lung cancer, he's like, you stop paying attention in that appointment. Your mind's racing. You're thinking about like your mortality and your family and what's going to happen. And the surgeon just tells you all these things, the nurse tells you all these things, and then you go home and he says, I don't remember anything that they told me because I was thinking about my life. And he said, well, the great thing about Seamless was that all the information was still there. It, prompted me of what to do, when to do it, when I prepared for surgery, for example. So it was great to know that like it was okay that he forgot everything or didn't, frankly, just nothing came in. I was curious if that sort of same experience happens to patients with cardiac surgery, or how it might be different for them leading up to the surgery.
Yeah, I would think that it could be the same. Again, every person is different. So some people might just, blank, and that becomes their main focus, whatever is being told to them. You need to have heart surgery, and they just kind of shut down. And that's why we need, family members around to maybe take notes or just, hear the information that's being said. So others are more, I guess, depending on who they are and their type of personality, they're more a go-getter about it. They're like, tell me more, give me all the information that you've got. What can I do to better prepare? How can I maybe make sure that, or help to make sure that the surgery goes well? So it does resonate with cardiac patients, that similar experience. But I think it's also important that to mention that not everybody has that experience. It's really who you are, and it is a possibility that you could react the same way.
Therese, with these different almost profiles of patients, how does digital health or SeamlessMD actually fit with every patient that's on the platform? Because the truth is every patient will be on a platform or for going for cardiac surgery. So how do you reach each patient and their various kind of profiles, where they're at, and provide the information that the overachiever wants and they need all the information up front, versus the other folks who are maybe a little bit overwhelmed and can't focus on everything at once? How do we reach all of those patients with the same program?
Yeah, no, that's a really good question. So as a patient education specialist, one of the things I do is while I'm inputting content and designing the program, we use something called Universal Health Literacy Precautions. So we never, I guess for lack of a better term, sugarcoat the information that's being given to patients. We give them everything that they might need, might think that they might need, but we do so in a way that is manageable for them to comprehend. So part of these health literacy precautions is writing at a certain age level, so under grade six or under, so that it's easier to understand, easier to follow. Writing really short sentences so the message is clear and it's clear what action they need to take. And honestly, having a lot of white space, because it doesn't have to be for patients. It also applies for everyday person like me and you. Sometimes when you see tiny text, it does get taxing to follow. So I guess that's one of the ways that Seamless does help to kind of cover and encompass all the things that patients might be concerned about. And we also provide education in different ways. So we have the education library, but we also give bite-sized to-do tasks, which are linked to an appropriate educational follow-up. So if somebody is ready to read something, they just click on that to-do task and they'll read about it. But if they're not ready, they can leave it there in limbo until they're ready and then just go right into it when they feel like they can.
Therese, I know one of the other things that you've worked on in these programs on Seamless is kind of like tailoring or having the pathway use like branching logic and personalization to kind of change direction depending on maybe the patient's past medical profile. So for example, I think for cardiac, it's not uncommon that some patients are on certain blood thinners, some aren't. And if they're on certain blood thinners, you want them knowing to stop it at a certain time. If they're not, you don't want them getting that or else they're confused. And I think sometimes it's hard to do that on paper, I guess. How do you sort of solve that challenge on Seamless?
Yeah, no, that's a really great question. So first of all, I have to shout out our engineers. They help us with everything and they make all this possible. So to your point, Josh, or to your question, Josh, how we control for it is we set something called patient characteristics. So when a patient first is enrolled into our program, we give them what we call a setup survey, and based on their responses on that survey, it'll set something in the back end that will help to control what the patient will see, so that they're not getting, stop your blood thinners at this point in time when it's not applicable to them. And by doing that, we are able to customize and tailor really to the patient, so that they have a really good experience. I guess the other point is when we discharge cardiac patients, we could run into similar issues. So we also have the ability to control if somebody's going to go to a skilled nursing facility versus a rehab center versus home. The types of questions we'll ask is similar but different. We'll ask them how they're healing, and let's say they're maybe not doing so well at home. We would maybe prompt the patient based on a recommendation after they fill out our health check, which is a series of questions. We'll prompt them to call someone or notify them that their clinical team may have been notified and somebody will reach out to them. Versus if they're having that same issue and they're in a rehab center or a skilled nursing facility, we'll tell them to contact a nurse, let them have a look, talk to them about it. Does that answer your question?
Yeah, it does. And actually, it got me thinking as well about when they're in hospital, right? I know one of the things that you mentioned earlier on the podcast is that there's certain exercises, maybe ankle pumps or breathing exercises or other things that you get patients doing those first few days of recovery, especially. And obviously, I know like OT, PT are kind of helping the patient learn these things, and maybe there's pamphlets, but kind of love to get your take on how do you kind of help enhance that understanding around exercises for patients on Seamless, and where do you think that's the most helpful for them?
Yeah, I would say, okay, so to your first point, how do we enhance it on Seamless? We do it in a couple of different ways. We provide, reminders to, do your exercises every day, and these reminders can go out daily. And in case somebody might be confused, what exercises do I need to do? We provide them with that education, and as part of the reminders, we also, send SMS, emails, things like that. So if somebody's not actively always on their phone looking at what do I need to do today, they don't have to, it'll just come to them, and then they'll be reminded in that way. And then, sorry, Josh, what was the second part?
Oh, yeah, I think I kind of phrased it kind of weird. I guess I was wondering if there were, I guess, certain features that we provide that you felt were most helpful in getting patients doing the exercises and maybe being compliant, basically.
Yeah, I think some of those features that help them to be compliant is the fact that they will get reminded without having to actively check Seamless. So uh, getting the SMS and, maybe they're out doing, I don't know, walking in the park or something like that. And then they get a notification, hey, like, here's a reminder, do your walk. And then they'll be like, perfect, I'm already out. Let me just do this right now. Let me walk for 10 minutes and then take a break. So I think that's one of the ways that Seamless helps to adjunct what they're learning in the hospital.
Gotcha. I also wanted to ask you about kind of when they go home, and I know one of the things that you've designed on the platform is for when cardiac patients are at home, and then they're I know that they're prompted to check in on Seamless every day and kind of track symptoms or warning signs or just overall recovery progress. And correct me if I'm wrong, but I think one of the things that you do is like you track like almost like what type of um, chest pain they might feel. And one of the complicated things I think about cardiothoracic surgery is that um, it could be cardiac chest pain, but it could be incisional pain. It's all in that same area. But I think you and the team have done some really smart things about how you help the patient track that, help the patient, the team at the hospital figure out what type of pain they're having, whether they should be concerned or not. Can you kind of maybe talk a bit about what we're doing there?
Yeah. So in terms of pain, we try to break pain down um, a little bit further than just asking like, "Do you have chest pain?" It would. It's a lot of things that we would kind of do similar in the hospital. So there's a lot of probing questions to it. So do you have pain? Where is it? Is it new? Have you had it before? And we ask all those kind of follow up questions so that when the clinical team, if they're or when they're notified that somebody's having chest pain, they have all the other information that might be relevant to to what the patient has been reporting. And we also help, I guess, kind of clear that up a little bit more when we finish when somebody finishes their health check and they're prompted a recommendation of what to do. There's always an attached education that a patient can read, and in that education, it'll explain more about maybe the different types of pain that they might be experiencing, what is normal, what is not normal, and what they should do.
Gotcha. So it's kind of like this, just so like for our listeners who maybe not as familiar with how this works. So would it be something like the patient gets prompted during recovery to check in on Seamless, and then when they go in the application, they're asked something like, you know, let's say, do you have pain in this area? And if they select chest pain, then they might get a follow up question asking about, is this pain like with physical movement, or is it with like shortness of breath? And if they say it's with shortness of breath, then they might ask them some more follow-up questions about cardiac related chest pain or something like that. And then based on what they respond, it sounds like the patient will get almost like a message at the end on kind of what to do. So if it gets flagged as more of a incisional pain, they'll get some education about incisional pain. But if it gets flagged as a potential cardiac related chest pain, they might get a more um, warning sort of feedback about calling someone. Is that kind of close to what we do? Or
Yeah, no, that's exactly what we do.
gotcha. And then one of the things that you mentioned, Therese, sounds like if let's say the healthcare team of the hospital decides, well, if it's potentially a cardiac type chest pain, I want to be notified, then they might get alerted for that. And then it sounds like when they actually go into these dashboards, they kind of get all this information already there. So like when they call the patient, they already know like how much pain there was, what associated symptoms the patient had with the chest pain. So they almost have like a fuller picture going into that maybe that phone call with that patient. Is that fair to say?
Yeah, exactly. That's definitely fair to say. And I think the other thing to mention, or is worth mentioning, is that when the provider looks at the dashboard, they'll also see what was pushed out to the patient. So what was the patient told to do?
Mm.
So if it looks like the patient was reporting something that was like new onset, sudden chest pain, uh, never experienced before, we'll flag them as going to the emergency room, and we'll also let the clinical team know.
Mm.
So the clinical team they'll have all the information that the patient inputted, and the clinical team exactly what you said. When they follow up with the patient, they'll be able to know exactly, where they are in their journey, and are they needing to be admitted into the hospital, where exactly, did they go, things like that.
Gotcha. And Therese, candidly speaking, and won't be offended if you find challenges with this workflow, but you're a clinical cardiac surgery nurse, and if something like Seamless were in your hospital and you had to consider getting alerts and monitoring patients after discharge, like obviously that impacts like your workflow, right? So how do you think about, like, if you putting yourself in your own shoes almost, but if you had seen, say you're at a hospital you were at, how do you think about, like, when would it make the most sense for you to be monitoring a patient on something like Seamless for cardiac care? Like, would you do
Um,
every patient? Would you be like picking certain patients? Just kind of curious your take.
I would think that it's helpful to actually monitor everybody, because somebody that you think is like, especially from practice, I've seen this, somebody you think is like the most, stable patient, they're ready to go home, and then right as they're about to go home, something unbelievable happens, and you're like, how could this have happened? They were, fine all day yesterday, the night before. So I think it's important to track every patient. And I think when we make it available to everybody, and patients know that this is an option for them to be enrolled in here and have this kind of like constant communication with their healthcare providers, they feel that they're, I guess, not dropped off in the whole healthcare process. Um, it's kind of scary, you're in the hospital, you see your doctors, nurses, literally like every hour, on the hour, you see some person from the medical team, and then as soon as you're discharged, the only person you're seeing or people that you might be seeing is your family, and they might not check in on you as much. They also might not have any sort of medical background, and maybe, or chances are, they actually are more afraid about what's happening to you than you are afraid about what's happening to you. So having everybody put onto the platform, whether or not you think that they might have a potential complication, is important, and I think it should be done. Yeah.
I think it's a great point, Therese. I think one of the things that I've learned or remember is that there are a lot of patients who I think sometimes they almost underreport their symptoms or how they're feeling. I feel like, and I'll look at your take if you've had this with family as well, but I feel like in certain cultures, patients don't want to seem like they're complaining or bothering their healthcare team.
Mhm.
And I think there's been some research that shows that patients in some ways are often more honest when they're kind of self-reporting issues through like a digital platform sometimes, because it's more like when you're asking patients for like to tell you how they're doing, they actually answer, but they won't necessarily just volunteer some of the stuff on their own. And I'm curious if sometimes we're able to pick up certain things that would have gone unnoticed because the patient didn't want to seem like they're bothering the healthcare team over something that was small, but it wasn't actually small. They just,
Mm.
like, they're not as educated as we are about what's a red flag or a yellow flag or whatnot. I don't know if you've ever seen that in your experience, like Alan or Therese, with family or patients.
I have actually. It was a family friend, but it seemed like a small issue to the gentleman. He didn't want to take up the nurse's time or burden the family with extra work, and it was, a relatively small issue that then avalanched into something much larger, just because he was basically too shy to speak to the team about whatever the issue was.
Yeah, I mean, I've seen it all the time in practice, where somebody doesn't want to call because they think they're bothering you for something small, and if they don't call you for help, something bad has happened. Like, I guess a simple example, in hospitals, they want to go to the bathroom, and they know how to go to the bathroom, and um, they just want to get up and go, but they're a little bit more frail, a little bit more weak, especially coming out of surgery, maybe a little bit um, like drowsy coming out of
Mhm.
having all these anesthesia and pain medicine. And we should be there to make sure that they get to the bathroom
Mhm.
safely and they don't fall. But if they don't call, we've had falls because of something simple as that.
Mhm.
um, so yeah, definitely have seen things like that in practice where they'll say they're fine, but you just look at them and something is not fine, but they're not willing to say it. So you have to really prompt them. And I think things like Seamless is because it's online, maybe you can disconnect a little bit that you're not stopping somebody during their day.
Mhm.
And if you just write it on there or leave it on there, the person who's supposed to be looking at it will come to it when they're ready. So it might seem more okay to write whatever it is you're feeling, and then somebody will just follow up with you.
I mean, the other cool thing that you mentioned earlier, Therese, is that because Seamless gives feedback when the patient reports anything, I know I've heard that a lot of the non-urgent symptoms or issues patients report in the platform, they're able to manage right away. So instead of them calling in about, again, I always use the
Mhm.
constipation example, but instead of calling in about constipation, they actually get feedback about how to manage it, and then they don't call in, they get help right away. So hopefully, there's a lot of low-level issues too that they're getting help with sooner.
Yeah, definitely. We try to make it so that the platform is helpful for clinicians as well. So if patients can self-manage at home, we want to build their confidence in being able to go home and take care of themselves, and we support them in doing that by giving the information that they need, and we also let them know when that information at what point that information is enough and you need medical attention.
Hey, Therese, have you ever like done a lot of like post-op follow-ups in your clinical practice, like the 2 to 4 week post-discharge visit?
So we don't. So because I was on the unit itself, we don't do the post-op follow-up visits. They actually go back to clinic and they do that there. However, we do sometimes get. I guess this is another thing: is patients sometimes feel that if you call the unit directly, it you are not bothering the doctor. So they'll call us. So we've gotten cases like that where they'll call us and they're like, "I know you just told me how to take this medicine, but I just want to make sure that like I'm reading this right," and we have to go through it with them again. But I think that's probably the closest to 2 to 4 week follow up. And yeah,
I was kind of wondering it because if you were in those follow-up visits, I was kind of wondering if you thought some of those could have been avoided with the patient using something like Seamless instead. Because I know like Alan, we have some other clinical partners where they've actually decided to um, like not have certain follow-up visits if the patient was checking in on Seamless and taking photos of their incision, everything was looking good and healthy. They didn't want the patient, driving back in 2 hours to the hospital, or even now during COVID. I guess most of those visits are now video visits, but even some partners are saying, well, if we can just monitor the patient's wound and symptoms remotely and they're doing fine, maybe we don't even have to have them wait for that video visit.
Yeah.
Just like have to say, hey, great job, you're doing well. And then that visit time slot could open up for someone who's like sick and maybe needs a heart surgery soon or something like that. Like I guess if you were doing follow up visits clinically, like do you think you'd be okay if you didn't see the patient but they were checking in on the platform and you can see like all their incision photos and how they're doing?
yeah, I'd say I'd be okay, but I would still maybe just follow up, and maybe there's something that they didn't report. So I would just maybe quick call, like 5 minutes or less,
Mhm.
or video chat. Hey, I see everything that you're reporting is looking good. I just wanted to check in. Is there anything that maybe you wanted to talk about or share about? And if not, then we can, maybe cancel the next follow up phone visit, if everything's going well. So
Mhm.
yeah, I'd say I'd be okay with canceling it. Just quick reassurance for them, making sure that they know I know that they're doing okay. And
Right.
yeah,
Or maybe something that would have been a 30-minute visit could be a 10-minute visit or a 5-minute
Exactly.
visit because you have this whole like almost this whole record of the last few weeks for them in a way.
yeah, for sure. I would say so.
I think it's also just added assurance for the patient as well. If
Yeah.
you get that 5 minute phone call, hey, everything looks good. They then know, okay, they are looking at my results, and they're keeping an eye on that. Also, I think just for relationship building and better experience overall, just having that human connection makes sense. But leveraging patient engagement and SeamlessMD to, change that hour follow-up drive to now a 5-minute phone call just to let the patient know, hey, you're looking good.
Yeah, I mean, so a quick thing, sorry, the crazy thing to me was like when I did some surgical rotations, I remember being in something like, I think it was like colorectal surgery, and we'd have these patients come back for their post-surgery follow-up, and they're waiting in the waiting room for like half an hour to an hour. The actual visit is like 5 minutes. The surgeon literally just takes a look at the incision.
Yeah.
It's like 90% of the time it's looking fine. And like, but we made the patient like come here, take a day off work, spend 30 minutes to an hour in the waiting room.
Mm-hmm.
It was just, I mean, as a patient, you would do it because you want to make sure you're okay. But as a provider, you kind of know that 90% of the time, like they really shouldn't have had to come here and do that.
Right.
Unfortunately. But anyways, sorry, Alan, go ahead.
No, and to your point, like maybe, the end of that meeting is just a reminder on certain education as well. And so all of that could maybe be avoided and is being avoided with some of our partners. Another point that I wanted to make, Therese, about your work with the cardiac surgery digital care plans on SeamlessMD and our programs in general is it's constantly under the process of being updated. So we're always interviewing patients, we're always getting feedback, and we're always making iterations of the product. Like one example that I know from the cardiac service line is, introducing the prehab, for instance, as a module on the platform to optimize patients beforehand. What has some of the feedback been like from patients that you've worked with or interviewed after their SeamlessMD journey?
For the most part, it's actually really positive. And I was actually looking back at some of the feedback, and I pulled away 3, I guess, major themes, if you want to call it. So from the patients who've completed Seamless, Seamless helps them to stay on track. There's always a lot of information coming at you at the hospital, especially post-op, and it's hard to keep everything in your head and keep it straight. So it helps them keep on track. And again, what you said, Alan, it's reassurance of what's normal and what's not. And also feeling connected to the healthcare team, even though they're not physically there with you. So it's also, it's kind of like you didn't drop off the healthcare system. We're still here with you. We're just maybe not physically there.
Right. I'm looking at the time. I think we should probably, Therese, we're doing this new thing called lightning round, or a fast 5 question. Basically, we're going to ask you 5 questions, and you get to answer, those 5 questions however you see fit.
What a privilege.
So, Therese,
okay, let me brace myself. Okay.
Brace yourself. The first question that we had is, what is your favorite book or the book you've gifted the most?
So favorite book might seem a little bit childish, but it's Oh, the Places You'll Go, Dr. Seuss.
Oh yeah.
It's,
That's a great
happy, it's a great book. It prepares you for life.
Honestly,
when you get older. Like,
Dr. Seuss was very gifted. I agree.
Yes.
Next question, Therese. Who is a person, dead or alive, who you'd love to meet?
Steve Irwin, because I have no idea how he could get so close to these animals and not be afraid. And I'm a little terrified. So if I wanted to meet some of these animals, I would want him to come with me.
Mm-hmm. Wait, did you like the Tiger King?
I didn't watch Tiger King.
Oh wow.
I'm sorry, I'm one of those people. I didn't watch it.
After you watch the Tiger King,
cut that out. No one needs to know.
You might want to watch the Tiger King as well.
Yeah.
Oh man.
And now it's been too long since it was released that you can't start it.
Yeah, it's funny because my parents started talking to me about Tiger King. I was like, I really don't know. I know the general gist of it, but I didn't actually watch it. I mean, I could watch it soon. Yeah. Right after this, I'm going to watch it.
Yeah, right after this. The next question. So this is something we know about Therese from being at the office, but Therese loves to travel. She's traveled all over the place and does some really exciting, thrill-seeking adventures. So Therese, the question is, what is your favorite place in the world that you've traveled to?
So I actually can't pick one favorite place, but I can pick a top 3. So I'd say Australia, actually all of Australia, love it. Curaçao, which is a Dutch Caribbean island, and Amsterdam.
Wow. Any particular reason for any of them?
Australia, people are just really nice. Culture, everybody's just hanging out, chill. They're all smart, so that's always interesting. Curaçao, very similar to people, culture. They actually have like a fusion of different cultures. It's like Spanish, Dutch, and everybody speaks like at baseline 4 languages, which was actually so amazing to me and made me feel like I should go take a language class somewhere, keep up with them.
I don't think I've been in that place.
Yeah.
You're out there.
Well, it was so interesting. I was like, how do you guys even learn to speak 4 languages? Like, little kids are speaking 4 languages. They're like, the TV is in English, but at home we speak this, and then school we speak this. So you just pick it up, and they're all like fluent. Which, I mean, that must do some amazing connections in their brain. And then Amsterdam, it was just different lifestyle. It was just really relaxed. I have a really funny story, but I really don't want to admit it. So
okay, how about you say this is your friend's story, and then we'll go from there.
Yeah, okay. So in Amsterdam, we were doing this biking tour, and we were near like some museum or something like that, and there was a whole slew of kids, maybe like grade 6 or something. They're just like running around in this big open field. I don't see any adults near them, and then my friend asked, like, why are all these kids out here? What are they doing? And they're like, oh, there's a school right over there. And here in our schools, we have fences around the play areas. So my first question was, where's the fence? And they were like, oh, sorry. My friend's first question was, where's the fence? And they're like, we don't really believe in fences. Like, it's really safe city. The number one thing for crime is bike theft. And I was like, wow, it really expanded how I thought about things, because I just assumed that every school had fences, and it's just not the case. It seems really small, but the tour guide was really confused when I was asking that question. And I after I asked it, I was like, I really should have thought about it. Oh, after my friend asked it, I really should have, or they should have thought about it. It's a dead giveaway. It's over. It was me. I give up.
I think it's a valid question, though. It's obviously, it makes you think, like maybe
for sure.
fences aren't needed in safer areas. That makes total
it
sense.
really does. Like, it really changed my perspective on how I think and how I think everything else should be. So it was interesting.
That reminds me, I have some friends who live, a couple of hours out from Toronto in a smaller town, and they don't feel as if they have to lock their doors there. I'm in Toronto. I will always lock my door.
Well, I think like when I was a kid, I saw the segment on like City Pulse 24 where, or maybe don't quote me on where I saw it, but they would just go around and to like neighborhoods, and they're like, it's so safe here. We can just open people's doors.
No.
And they were like a reporter who was just opening people's doors.
Oh my
and
God.
It was open.
It's amazing. It's just a family eating dinner. Like,
yeah. And then as soon as they opened, the person from the inside was like, oh, hello. Like, who are you? But they weren't like, oh my God, get
alarmed.
Out of my house.
That's so funny. That's so good.
Yeah.
All right. So just wrapping this up, we have a COVID-19 related question. Since the pandemic started, what is one hobby or activity you've gotten into?
So I know you guys know this, but I am now a master barber, with only 2 times of cutting hair. I'm actually a master. So that was one thing I had to learn how to do in COVID, and I think I got pretty good at it.
Wait, are you cutting your own hair?
You're not cutting your own
hair. No, barber, master barber. I'm cutting men's hair. Specifically like one person's hair.
Okay.
You're really good at cutting this one person's hair now.
Really good. I really like understand the shape of their head and where the colics might be. So yeah.
And you got pretty good. You were doing the fade on him.
Yeah, I did the fade. I did a proper fade after watching a lot of YouTube tutorials. So
Actually, funny tie back to and shameless promotion on our 3rd episode, I believe, of the podcast on readmissions. Josh had just cut his hair, and it was inspired by your talk, Therese. You showed us, here's, how I cut my partner's hair, and how that, and then it inspired Josh to go out and cut his own hair.
It's a true story, Therese. Because of you, I may never go to a barber ever again.
You cut your own hair, or you had somebody else cut it for you?
No, I cut my own hair, and then my fiance notices all like the stuff I did wrong, and I don't care.
At the end of the day, it's hair. It's gonna grow back out, so it's fine.
Exactly.
You can try it again. My first time cutting hair, not good. It was like 2 hard lines for the fade. He wore a hat, and it's, we fixed it the second time around.
That's great. You have to charge him now. That's good.
Maybe. Yeah.
All right, Therese, last question that we have. Tell us a story that you haven't shared publicly before.
So not shared publicly, but I think maybe a few people know here and there. I actually wasn't planning to become a nurse when I'd come out of high school to go into university. It was like one of those last minute applications that my mom's like, please just put the application in, and you don't have to do it, just put the application in. So, please her, I put the application in, and then you get the replies back from everybody, and you get all this, like, you can compare everything that you want to do. And for whatever reason, I ended up choosing nursing, and it was like the best thing I've ever could have done for myself. So yeah, not a lot of people know that. My mom's probably going to see this and want credit for everything that's happened in my life now. So thanks, Mom.
Wow. Wait, so Therese, in an alternate universe, like, what is this other Therese doing instead if she's not in nursing or healthcare?
Oh, that's a good question. So back then, what I applied to was things like pharmacy, life sciences. Yeah, pharmacy and life sciences is what I would have been. So I could have been, I don't know, a researcher, working with medications. I'm not really sure.
Well, so you'd still probably be something like healthcare is happening. I mean, this podcast might still be happening, actually.
Maybe. I mean, it's possible, unless I do a life science route and I learn about, fish and become a zoologist.
Oh, but that's our next episode right now.
Exactly. Yeah, that's good. Wow, I didn't know that, Therese. That's actually really cool. But it's funny, in my head, I could never see you doing that route of like research. You're so good with people and talking to patients and people. And that's obviously like your frontline experience kind of shining through there.
Thanks. It's a learned skill. I used to be like a really shy kid, but just roll with everything that's happening.
Yeah. Look at you now. You're on a podcast.
Look at me now.
The number one podcast.
That's right. Yeah. Oh, that's good.
Like if you go to the Apple, was it the iTunes? Let's think there's like the Joe Rogan Experience is number 1, and then there's number 2 Seamless. So we're really close.
Well, actually, and Joe's not on Apple Podcasts anymore. He signed some big deal with Spotify, so we're the number 1 spot now. So
Spotify, I've never heard of it.
All right, that's great. Therese, I'm looking at the time. We're a little bit over, so we wanted to wrap it up. But I did want to thank you for being on the show today, bringing a wealth of experience in cardiac surgery, especially around digital patient engagement and how we're engaging patients. Josh or Therese, did you have anything else to add on the cardiac surgery topic, or?
I just want to say thanks for having me. I hope I added something and something valuable to all of this. And if anybody's out there watching this, reach out to Seamless.
Exactly.
Or if you want advice on how to just randomly apply for stuff and then still love it anyways, definitely talk to Therese. Yes. Thanks so much, Therese. Really, really happy to have you here today.
Thanks, guys. Thanks so much.
Thanks, Therese. Bye.